Hello and welcome to Health Watch. This is a program geared towards promoting all things healthcare at the BVI Health Services Authority. I am Damian Grange, your Marketing and Public Relations Manager here at the Authority, and it is certainly our pleasure to be with you on this episode of Health Watch. Today we're going to focus mainly on some of the things that the BVIHSA is doing to ensure that, one, we provide the highest quality care, but also with safety and being conservative in mind. To guide us through that, we're going to have on the program, and I'm excited, it's his first time sitting down with us, Dr. Jamal Wins. Dr. Wins, welcome to the program.
Thank you very much, Damien. I appreciate you having me on here.
Absolutely. Now, Dr. Wins, this is exciting for me, and I know certainly for you, because this is something you have advocated for a long time.
Correct.
But tell us what you do with the organization before we go forward.
Sure. I am the clinical and informatics pharmacist here at the organization.
What does that mean?
I know it sounds very convoluted, it sounds very fancy, but to make things simple, I essentially assist the physicians on the clinical end by ensuring that all the medication charts, everything that you would need is appropriate for you as the patient once you come in to the hospital, because it's a holistic approach within the HSA, the BVIHSA that is. So we want to ensure that what you're getting is what you need. But the other hat that I wear is informatics, and that's the one I think a lot of people don't know what that is. We're in the 21st century, and we are moving towards having everything computerized.
Absolutely.
So we want to ensure that even though that things are computerized, we have some sort of clinical minded focus behind that. So I am on the pharmacy end, but there's a large swath of individuals that are involved, from nursing to the physicians,
Right.
to ensure that the system, which we'll talk about briefly, which is Meditech, we ensure that that is running efficiently. We ensure that everything that needs to happen from the computer side of things, that is working as it should.
Great. Okay, well, informatics, I now explained. We have just made a significant investment
Correct.
in the OMNICELL platform. Is that, am I?
It's the OMNICELL automated dispensing cabinets.
Yes.
It's a very long tagline,
Yes.
but moving forward, we'll just call it OMNICELL.
OMNICELL.
So yeah, we did make quite a significant investment. So I guess we can jump right into it.
Yeah, no, because I want our audience to have an appreciation of what is happening at the authority,
Okay.
why it's being done,
Right.
Because sometimes people may not have an appreciation for the investment that goes into healthcare, and so I want to bring that to the forefront.
And that's great that you bring that up, because I think that a lot of people don't actually know some of the great things that we have here at the hospital, which I might add is actually very unique for the region. I think the closest hospitals around us that kind of has this technology are in Puerto Rico and St. Thomas. So it's important to highlight and stress that we're at the forefront of technology within healthcare, within the BVIHSA. So just a little bit about OMNICELL. It's not our first time interacting with it. We've been engaged with this company from 2014.
Yes.
So we've had about a decade's worth of experience with this technology. But with technology, things evolve.
Yes.
And we want to make sure that we are at the cutting edge. We want to make sure that we are meeting international standards, because the public might have seen, in past, the DNV, which is our accrediting body.
Yes.
They have guidelines that we want to ensure that we're meeting quality service, and we want to ensure that we're meeting what is required of us as a healthcare organization in the 21st century.
Yes.
So we were required to upgrade our OMNICELL cabinets, because day in, day out, they're normal wear and tear. You have to change your computer every so often. The same thing we have to do with those. So we had to upgrade those machines to this year's model. Just to get into the model names from the G4 to the XT. So that's what they have currently.
Yes, what he said.
And I think I might have missed that part for those that are wondering what an OMNICELL cabinet is. So as I mentioned before, it's an automated medication dispensing cabinet. So just to explain basically the entire system so you can understand, we have two systems. We have Meditech, which we went live with in 2021, I think about April, May of 2021. So that is our electronic health record. So once you come into the hospital, physician is going to do the assessment. Also, the nurses are going to be doing their assessment, and all of this is logged electronically.
Yes.
Well, obviously, depending on your ailment, you're going to need medications. So that order is placed in the system, and then the pharmacy department, we verify that medication, and we actually work 24 hours a day.
Yes.
Even when we're at home, just to get that
verified
and ensure that what you're getting is therapeutically appropriate, so it's appropriate for your condition. Once that's verified, it automatically transfers to the OMNICELL cabinet. So all of this is done in real time. It can be instantaneous, and that's and then once you get that medication, we call it a medication order. Once that crosses over to the cabinet, the nurse can go and pull the medication for you. And before she does that, Meditech and the organization in general, because safety is also something that, as much as possible, we try to negate. Nothing is perfect, but we try to negate any harm to a patient. Each medication is barcoded, and before you receive that medication, the nurse traditionally scans that medication, and she scans your patient armband. So,
just to ensure that the right medication is going to the right patient.
At the right time, right dose, and she has 12 to 14 rights that she has to adhere to. And we want to make sure with this system that that closed loop of safety and quality is ingrained into the entire experience. So this is very important, and which is why we wanted to make sure that we upgraded the machines. I hope I'm not.
No, I'm learning. But for the benefit of our viewers, I also want them to know that Dr. Wince is going to give you a brief demonstration. So stay tuned. That is to come. Dr. Wince, you talked about safety and efficiency. But we mentioned at the beginning the investment that went in. And there is an expectation that the OMNICELL equipment in the long run will pay for itself. Can you explain how that would be?
So again, with technology, it's not cheap. It was a multi-million-dollar investment for us. It was a long journey. We've been at this process for the greater half of 3 years just to ensure that what we ordered, because we had to order this from overseas, of course, this technology is out of the United States. We wanted to make sure that the expenditure was, low enough to the organization as well as to the community writ large. But at the same time, we want to make sure that we didn't shortchange ourselves.
Of course not.
So over time, we expect that this is going to pay for itself, because with this system, as I mentioned before, the medications are unit dosed. So if you did not receive that medication, or if you didn't, there's something that happened with your care, we have the ability to recoup that cost in that, it can be repurposed, or sometimes, we can track the inventory. So as much as possible, nothing is wasted. We could track expiration dates. We could track everything, with the quality of the medication, even in the refrigerators, because this medication, this technology integrates with our medication fridges. So as much as possible, we try, by utilizing this technology, it decreases the amount of expenditure to the organization and the insurance scheme, because that one of our largest costs for the insurance schemes are just the cost of medications. And they've not been going down, especially with inflation. it's been a tough time for us even to procure medication. So any technology that we can automate our lives and make things easier for us, in the long run, it can pay for itself. I know that, it seems like we're just spending money like wild, but it is something that we've thought long and hard about. We've had discussions on the board and the executive and the Ministry of Health level about this stuff, to ensure that we are implementing cost-saving measures within the organization.
Of course.
Yeah.
Obviously, with you being able to automate the expiration date, it makes sure that the medications that are closer to expirations are removed.
And sometimes we can repurpose them because, for instance, if like you're on a ward that it's a slower moving medication, we always ensure that, hey, okay, well, this medication is still appropriate for use with it. We have the ability to shift that around. So we always ensure at the end of the day that there's minimal wastage, and we have seen that, and that's a good thing about being in the second generation of this technology. We have seen over time the decreased expenditure to the organization because we have appropriate prescribing by physicians, we have tighter controls, and we have an increased, I guess, communication between the different disciplines, between nursing and pharmacy and the physicians, because these technologies, that's what they were designed for, to have greater communication. And it's no secret to the general public that we're a massive organization. It's almost 700 strong at this point. So it's important that we have these technologies in place to, increase our lines of communication and increase patient safety.
Yes, and that is above cost savings and all of that. The important thing is the patient safety aspect.
Correct.
Because the idea of having that electronic check and that balance check system that is built in, making sure that the right meds, the right dosage are being dispensed, I think that is unbeatable.
Yeah, I mean, and that's something that we're incredibly proud of. And I also would take this opportunity to thank the listening public for their patience, because I think during the month of November, we actually had to close our outpatient pharmacy services for 2 days at a time so that we can scale up operations in terms of, because we had to switch from old machines to the new machines, and that was a massive undertaking in terms of manpower hours. And I am immensely also thankful to the staff of the pharmacy, and of course the young men that came from the company, because we actually had individuals from the company on site to ensure that everything that we had was working appropriately. So I'm immensely thankful to all the parties involved for leadership, for being patient, for being understanding, because they're just not going to sign a paper away without asking some questions.
Of course not.
And they've been very understanding to ensure that everything's going smoothly. So thankful to all of them.
Talking about the staff, was any training involved in ensuring that persons are adept with the use of the new system?
Yeah, so we're definitely still in infancy stages, because honestly, at the time of this interview, we just closed off on the project yesterday. So throughout about a 2-month period, we've definitely had some training, and the 2 guys that I mentioned, James, Derrickson, and Robert, were on the ground to ensure that both our pharmacy staff and our biomedical staff, because once they're gone, someone has to fix these machines, their computers. So there was some training involved with that. And of course, we're in the 21st century. So the great thing is about being involved with a company like that is that they have some training videos online. So even for the new individuals that come to the organization, you have the ability to learn things remotely. So there has been some training, even for the nurses, because it's new software, new technology. That it's a strange frontier for some people, and there's some individuals in the nursing, and they're coming from backgrounds.
A different system.
Just a different system. And some of them have never seen this technology
Right,
before, so
right.
this is quite new for them.
Yeah.
So, we have continued, so not only at this instance, we always have continuous longitudinal training
Yeah.
that happens with these machines.
And actually, that is also, to go back to accreditation, that is also the part of accreditation that impresses me the most.
Right.
Because there is an insistence on the fact that training and education must be part of your organization if you are going to maintain your accreditation.
Correct.
And it must be ongoing.
Right.
Yeah. Dr. Wins, all of this excitement may want to see what this machine look like now.
Okay.
So I'm going to let you take both me and our audience on an experience tour of the machine, so you could explain how it functions, and so they can also see and have an appreciation for what it
Absolutely,
is.
because I think we've been talking in a vacuum, and
Yes.
it seems like a fancy machine that they don't know what it looks like. So yeah, we definitely
All right.
can show you that.
You're going to see what this machine looks like in just a moment.
So now we're just headed to the medical unit so that you can actually see the technology in practice. So just follow along. All right, so as I discussed before, this is our new cabinet, the OMNICELL XT cabinet. Just to give you a bit of an overview of how it works, as I mentioned before, there's medications that are stored within the cabinet, the ones in the glass enclosures. These are for larger medications such as the IVs and the liquids. So we typically keep them up there, but the smaller tablets, we keep them in these drawers. So just gonna give you a brief overview of what either a typical technician, pharmacy technician or pharmacist or a nurse would do on a daily basis. So here, as you can see, there's a big fingerprint reader here. So you're just gonna log in. And we're gonna go to, we can actually take a medication out for a patient. So I have a test patient here. As you can see, this tells us all of the allergy information. It tells us, everything in terms of how to remove the medication, and you can return the medication. So traditionally, this is what you would see. You would see the bedroom, the room and bed that the patient is in, and all the additional information on the bottom. So I'm gonna go here to remove meds. And I'm gonna take out just a few medications for my test patient. And I have another one. I have, so now you can actually see here, this is what the nurse typically sees. She's gonna see the dose that was ordered from the physician, and this is again transmitted electronically. And this SIG means how it was ordered. So she sees it in her computer, and she can also see it at the level of the machine. So when she goes here, she'd hit OK and remove now. And as you can see, the bin is gonna light up actually. So it is actually just like that. She pulls it open and it's gonna blink as to where the medication is located. So this is usually what you would see when the patient, when the nurse removes the medication. So you would have the medication name and you would have the expiration date. And this thing that says lot, that is the manufacturer's information that they place on there. You can also see a funny little barcode here, and that is for the nurse to scan. So as I mentioned to Damien, once you scan the medication, you can scan that and then scan the patient armband so that we can ensure that we're giving the right medication to the patient. So this is all part of our safety protocols. Another feature that we actually also have when it comes to this new system is the ability to track medications within our refrigerator. So here, I'm gonna actually show you how that looks. So you would remove it, you can take out the medication, you withdraw what you need, and then you just place it back in the refrigerator. And it locks. And once I lock that back, you can see that you just actually can't open it like that. So we did it that way just so that, we don't have any inadvertent access to the medication. And we actually have the ability to, once we're on the front screen, we can track the temperature of the fridge from the front of the screen before we even go into the refrigerator. So that is a brief overview. There's obviously a lot more that is done on a daily basis. As you can see on the side here, we have a bit of a strange looking bin. As I mentioned to Damien, he asked the question about, decreased expenditures to the organization. Once we place this back in the bin, once it has not been used and we determine that there's no damage to the medication, it can actually be repurposed and placed back into the cabinet once it hasn't reached a patient, etc. So that's one of the ways we want to make sure that we stay economically focused once we utilize these cabinets. So we're also now in the emergency room, the ER nursing station. This is one of our larger OMNICELLs. Actually one of the most active OMNICELLs that we have in the organization. As you can see, it looks a bit different from the other one that we had because, there's so much that we have to store here that we've actually kind of changed the configuration of it. So there's the main tower here that controls another tower. There's right off to my right. But it's the same concept. It actually looks relatively the same, but there's a lot of things that we can change based on our requirements. And we bought almost over 10 or close to 20 OMNICELLs like this. The configurations are endless, just based on each place in the organization's needs. We have some in the Virgin Gorda Clinic that also looks a bit different. But it all depends on what our requirements are. So similar concept, just a bit of a different setup. So that's kind of all I just wanted to show you guys.
Well, we're back in the studio. Dr. Wins, thank you so much for that demonstration.
Absolutely.
And explanation.
My pleasure.
Letting us know how it works.
My pleasure.
I'm excited. I know you are. I see you busy throughout the hallway, throughout the months, trying to make sure things get on track. You and your IT team been at it. And so before I forget, let me just say thanks to you and the entire team for ensuring that this process went as smoothly as possible. And because of the hard work of the team, I know that we have improved on our quality and safety in terms of the dispensation of medication throughout the organization. With that, is there anything that we need to add before we wrap up the program?
I think the last thing to add is just the general public, I guess, just understanding that, I know that sometimes it may be a bit of a challenge when you may interact with a healthcare organization. You may not understand as to why this is the way that it is, but just stressing the importance of, at the end of the day, we are a patient-focused organization.
Yes.
And the things that we put in place and the procedures that we put in place are with you in mind.
Yes.
It may not look like that on the surface of it, but I promise you, I personally, being a patient at some point in time, everyone's a patient.
Yes.
I don't want to know that I'm spending money on something that's not going to increase quality outcomes, because the reason we purchase these things is just that we could have a bit more patient face-to-face time, because I know that's something that we've heard the complaints, we've heard, and we listen, and this is something that we're continuously working on. There are going to be different technologies. I hope to be back on the program. There are different technologies that we're working on to come in the future, and that we hope that can better the lives of the patients and the community in the British Virgin Islands, because that is one of the main goals of this organization. And I hope that we can continue to forge ahead, not only in this region of the world, but globally. I mean, I think we can be a unique model for
Absolutely.
other organizations of this size or even larger.
Yes.
So yeah, those are my parting words. I again truly thank you guys for bringing me on the show. I really hope that the public has gain a bit of an appreciation for what we do here and what we continue to do.
You broke it down for us, and if I can understand it,
Yes.
anybody can understand it. So
Okay.
thank you, Dr. Wins. It's certainly a pleasure.
Yeah.
And good luck as you continue to work hard to improve the quality of care within the organization.
Thank you, Damon. Much appreciated.
All right. You have just watched another episode of All Things BVIHSA, and this is our opportunity to share with you all the growth and all the investment that we are doing to ensure that you, the public, get the best care possible. After all, we are committed to excellent health care in the Virgin Islands, and the BVI Health Services Authority, as Dr. Wins mentioned, is on the forefront as it relates to organizations within the region in the cutting edge technology, and we will continue to do that just so that you have the best outcome as a patient of this organization. Until our next episode, walk good.